and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Brian dela Cruz from the University of Oklahoma Health Sciences Dietetic Internship Program based in Oklahoma City, Oklahoma. All right, welcome to the podcast, Brian. To get us started for this episode, I would love for you to give us a little bit of an introduction to you, your journey to where you've gotten today, and how you landed with the University of Oklahoma.
Well, first of all, Dr. McKinley, I just wanted to say thank you for inviting me to speak at your podcast. I think this is a great thing that you're doing for students as they're getting ready to get into dietetic internship programs. But yeah, as far as a little bit about me, so my journey into dietetics, when I was a student in college, I knew I wanted to get into medicine, but I didn't quite know specifically if I wanted to be a doctor, wanted to be a pharmacist, a nurse, or what. And so I was exploring all these different options, working in the healthcare profession. And the thing that always came back to me as far as what I wanted to do in working with patients was that I wanted to work with patients to help them prevent diseases like type 2 diabetes, heart disease, kidney disease, things like that. Because I always thought that living a healthy lifestyle is a lot easier than having a disease state and trying to go back to a healthy lifestyle. So when I discovered that's what I wanted to do, is try and prevent diseases, I came across this profession called, of course, nutrition and dietetics. And so I was actually an undergraduate student at the University of Oklahoma on our Norman campus. And then I graduated with a bachelor's degree in biochemistry, and I worked at one of the research labs at the University of Oklahoma Health Sciences Center. And while working there, that's where I discovered the nutrition and dietetics profession. And so I applied for our DPD program at the University of Oklahoma, got accepted in our program. And then I continued on with my internship also at the University of Oklahoma. And then after the dietetic internship program, I actually continued on and got my Master's of Science degree, again, at the University of Oklahoma. And then I worked for a year as a bariatric dietitian. And I will say that I loved that job. Now, yes, many of the patients that I worked with, they did have disease states like type 2 diabetes or heart disease. But what was so rewarding for me was working with these patients and counseling these patients for behavior change to get back to a healthier state. And I really, really loved that job, getting to counsel these patients. But then an opportunity arose for me to it wasn't dietetic internship director at the time, it was clinical coordinator, which is kind of the individual that works with the internship director at the University of Oklahoma. And when that opportunity arose, I was thinking back and forth, do I want to take this position? And in the end, I thought to myself, well, I really enjoy counseling patients, helping patients reach their healthy goals. But if I can educate students, then I could reach a lot more individuals, meaning that I could, of course, mentor these students to become registered dietitians, where then they can reach more patients and clients out there to help lead them towards a healthy lifestyle. So then I took that position as clinical coordinator for our nutritional sciences department at the University of Oklahoma. And I loved the job where I was working with our preceptors and scheduling rotations for our interns. And then a few years into this job, the internship director, she retired, and that opened up the opportunity for me to be internship director, where I get to work with not just our preceptors, but our interns. And ever since then, so I've been working with the University of Oklahoma since 2012, and then I took over the role of internship director in 2015. And ever since then, it's been such a joy. I enjoy working with our interns and watching them grow in their nutrition knowledge throughout the program, seeing them apply that knowledge that they get from their DPD program and actually practice what they learned in the classroom out our facilities. And when we reach graduation day, that's just such a rewarding feeling for me that I was a part of their journey towards becoming a registered dietitian. So yeah, it's a little bit of history about me. And I'll say this, I love this job here. I think it's very rewarding to get to work with interns, get to work with our preceptors as well in providing the best possible experience for our students to become successful registered dietitians.
Right, that is awesome. So I'm going to let you take it away to tell us all about your program.
Absolutely. So do want to go into some information here about our dietetic internship program. Now, you'll see here on your screen, I do have a QR code there. That's for me to just gather some information about you, where you'll enter in your name and your email address. And then I will send you additional information about our internship program. I'll send you information. I'll send you our program brochure along with a link to our website and links to our social media pages. So that way you can see various different pictures of our interns and what they do out on their rotations, along with a link to information about open house sessions, virtual open house sessions that I will be holding. And if you want to RSVP for one of the open house sessions, you are welcome to do that. So please use your smartphone and scan that QR code. All right, let me move on here to so the first thing that I want to go over concerning our internship program is our mission statement. I always like to read our mission statement, and there's some things that I want to go over concerning our mission statement. So let me read this to you. The mission of the OUHSC Dietetic Internship Program is to provide the best possible supervised practice experience for our students to become competent entry-level registered dietitian, nutritionist, and future healthcare leaders. The program prepares students through excellence in teaching, research, service, and appropriate supervised practice sites, which foster creative activity and innovative lifelong learning to therefore provide exceptional patient care to the public. Now, there's some things that I want to mention about our mission statement. One of the things that I state here is we prepare our students to become competent entry-level registered dietitian nutritionist. Well, I'll say this. So whenever we graduate a group of students and whenever they find their first job, okay, a year after they find their first job, I actually do a survey of these employers. And I ask them, hey, was our graduate prepared for their first job in dietetics? And the comments that I always get from these first employers for these graduating dietetic interns is that these employers say that no, they're not only practicing at an entry level, they are practicing at a level where it seems like they have 3 or 4 years of experience. And so that's great feedback to me from these employers that our interns, when they graduate from this program, they are definitely prepared for the workforce for their first job. So that is a huge benefit of our program. Yes, it's a rigorous program. I'm not going to sugarcoat it, but we make it rigorous because we want our graduates to be prepared for that first job. We want our graduates to be competitive applicants to get their dream job. Okay, so many of our graduates, they are not only competent at an entry level, they are competent similar to a dietitian that's been practicing 3 or 4 years. Okay? And then we also, I'm going to be talking about this as well, appropriate supervised practice sites. We have so many opportunities for interns to see all different areas of dietetics, whether it be WIC, eating disorders, diabetes, cardiac rehab. So I'll talk about all the different rotation sites that we offer. And what we do is we cater the rotations to the interns' interests. So those were a couple things that I specifically wanted to mention about our mission statements. I do want to go over some general characteristics about our internship program to give some information about our internship. Of course, you can see there, I am the Dietetic Internship Director. Again, I've been serving as Internship Director now since 2015, but before that, I've been working with the University of Oklahoma since 2012. We have 2 internship classes per year. We have a spring class that starts in March, in mid-March, and then they graduate in November. And then we have a fall class that starts in August. So I actually had a class that started just a couple of weeks ago, and then that class graduates in April. Now, I do want to mention this, our spring class with the March start date. I know that sounds a little unconventional because normally a spring class would start in January, but we do start in March. And there's, benefits, pros and cons to that, basically. Now, a big pro to this is because some DPD programs, they may graduate students at the end or at the middle of December. Some DPD students, when they graduate, they want a couple months off before starting an internship. And that's why we decided to do that March start date. Not only that, it's a bit tough when you graduate in December, trying to get all the paperwork that we need to start an internship class in January, just because there's winter break right in between. And of course, myself, along with staff members in our department, we take time off. So that's why we start in March. But a lot of interns that I've had that started in our March class, they said that they really appreciate when they graduate in December, having at least a couple months off before starting the internship instead of starting the internship right in January. Okay? So that's why we do that March start date. And then our fall class, that is typically a conventional start date, but we do start a little bit earlier than the regular semester. So actually here at the University of Oklahoma, our classes actually just started, but then we have our internship class start at the beginning of August. Our program is accredited for 30 interns per year, meaning 15 interns per class. So 15 interns in the spring class and 15 interns in our fall class. Now, this is the approximate cost for tuition and fees. You can see that there. Now, I'll say this, just this summer, our university was approved to increase our fees. That happens. So this isn't entirely accurate, but it's just a little bit more as far as the cost of tuition and fees. So that just happened. So I need to get with our financial aid office to find out the exact cost, but it's going to be a little bit more than what's stated here. So I think it's going to be roughly $9,500 for Oklahoma residents, and then a little more than 13 grand for non-residents of Oklahoma. And that is just for tuition and fees. And so here again is the tuition and fees, but there are additional costs, of course, for housing and personal transportation. Interns are required to have good transportation, just because here in Oklahoma, we don't have a good public transportation system. And so interns do have to have their own personal transportation to get to their rotation sites. Okay? Books, and then professional clothing and other costs, such as a laptop, the cost to be a member of the Academy of Nutrition and Dietetics, and other costs. Now, we do have financial aid available through the University of Oklahoma Financial Aid Office. And then, of course, there are lots of scholarships available for dietetic interns as well. There are scholarships available through the Academy of Nutrition and Dietetics Foundation. There are scholarships available through our state affiliate, the Oklahoma Academy of Nutrition and Dietetics, along with various different district dietetic associations within the state of Oklahoma. And then we also have scholarships within our own nutritional sciences department. But beyond that, I mean, there are many other scholarships, not specifically for nutrition majors, that many students can apply for. And I always encourage our interns to seek out those scholarship opportunities. But anytime that I hear about a particular scholarship for nutrition and dietetic students, I definitely forward that along to our interns and give them that opportunity. And then I always go back to the foundation scholarships offered by the Academy. Many of our interns, I'll say this, when I tell this to our interns to apply for an Academy scholarship, many of our interns are like, man, there's going to be thousands of interns who apply for those scholarships. And they're like, I don't want to bother with trying to submit an application. Well, I always tell interns, what is your percentage chance of getting a scholarship if you don't apply? And I'm like, it's 0% chance. But then I tell them your chances go way up if you just submit an application. And I can't tell you how many times one of our interns who does submit an application thinking he or she will not get a scholarship ends up getting a scholarship from the Academy's foundation. Okay, so yes, there's a lot of opportunity for not just financial aid, but getting scholarships to help with the cost for tuition and fees and other things for the dietetic internship program. All right, let me talk about the structure of the rotations in our program. So our program it's actually an 8-month internship program, and I think that's on the next slide. I kind of mixed up these slides here, but I want to talk about the rotation. So overall, our internship program is 8 months in length. Okay? We have a 9-week community rotation, a 9-week food service management rotation, a 9-week clinical rotation, and a 5-week elective rotation. I'm going to talk a little bit more about this elective rotation here in a second. Okay? But you can see here, rotations are not completed in any particular order, but the elective rotation is always completed as the last rotation. Now, going back to these 3 major rotations, the community, the food service, and the clinical rotation, we have each of these 3 rotations evenly distributed as far as the amount of time spent with each of these 3 rotations. Now, a big benefit of that, and something that attracts a lot of potential applicants to our program, is that, hey, I don't know what I want to do yet as a dietitian, whether it be a clinical dietitian, working in food service management, or working out in the community. So that's why we have our interns spend equal amounts of time in those 3 major rotations. So we do attract a lot of those applicants who say to themselves, well, I don't know what I want to do yet as a dietitian, and I want to explore all options equally. Okay? Now, I do want to talk more about this 9-week community rotation here in a second, and I'll do that here in a second. But I did want to say also, again, I mentioned this, rotations aren't completed in any particular order, meaning that maybe intern A will do food service management rotation first, and then intern B will do clinical rotation first, and then intern C will do their community rotations first. Okay, and then the second 9-week rotation, everyone will flip-flop to a different rotation. Okay, so that's how those 3 major rotations work. Now, going back to the community rotation, okay, with the community rotation, this is where we customize the rotations to meet the intern's interests, meaning during those 9 weeks, interns will spend time at various different rotation sites, whether it be at the diabetes clinic, or the WIC clinic, or the dialysis clinic. Okay, I will always ask the intern, what are you interested in? What are your top 5 interests in community dietetics? And based off of what they state they're interested in, then I will customize that 9-week community rotation experience to meet that intern's interest. And that's a huge, huge benefit of our program. Something that many interns have stated to me when they finish the program is they really appreciate that I take into consideration what they are interested in and what they are interested in seeing. There are other programs out there that they have their community rotations or all their rotations set, that every intern will rotate at the diabetes clinic for a few weeks, will rotate at the WIC clinic for a couple of weeks or something like that. Okay, but I customize those community rotations to meet the intern's interests. Now, as far as the 9-week food service management rotation and the 9-week clinical rotation, typically those rotations are done all at one particular hospital. So that way an intern will learn about food service management in that particular hospital and then transition into the clinical rotation to learn about clinical dietetics at that particular hospital. Now, our program at the University of Oklahoma, we are affiliated with all the hospitals across the state of Oklahoma. And typically what we do is we assign an intern to rotate for 9 weeks of their management rotation and their clinical rotation at one of these hospitals in the state of Oklahoma. Okay? So that's how our each of the 3 major rotations work. Now, the 5-week elective rotation. This again is something that when interns graduate, they tell me that they really enjoy the 5-week elective rotation. And I think this is something unique to our program. Now, first of all, it states here, interns get to choose their elective rotation facility. So again, I customize this experience for the intern's interest. If we have an intern that's interested in sports nutrition, or eating disorders, or pediatrics, like working in a clinical setting in a NICU, I will work with that particular intern to get that elective rotation set up. And not only that, is we're not limited to rotation facility, elective rotation facilities within the state of Oklahoma. Our internship program, we get interns from all over the United States. And if an intern is, for example, let's say if we have an intern from Florida, and this particular intern says, hey, I want to go back to Florida. I know a dietitian in Florida who is willing to host me. And I want to go back to Florida to complete this elective rotation to allow me to network with dietitians because I'm going to move back to Florida. Then yes, I am always open to exploring any option that an intern wants to do for their elective rotation, not just in Oklahoma, but anywhere in the United States. And what I always say to interns is I'm open to exploring any option. I can't promise you that that will provide you with this elective rotation facility opportunity, but I'll do my best to try and get something like this set up. Now, I'll say this, some of the unique elective rotation opportunities that our interns have gotten to do in the past is I've had an intern rotate with the Philadelphia Eagles, the dietitian with the Philadelphia Eagles. I had another intern, she rotated with the dietitian with the Dallas Cowboys. I had an intern do a rotation at the MD Anderson Center in Houston. I've had various different well-known eating disorder facilities, all of different parts of the United States. So yes, our interns have gotten the opportunity to do very unique things in their elective rotation. And those are some of the more unique opportunities. Of course, in Oklahoma, we've got very unique opportunities to complete the elective rotation as well. Okay. So that's a little bit about the structure of our rotations and what our interns get to experience out on their rotations. Now, again, some more general characteristics about our program. I mentioned this already. It is approximately 8 months in length, and interns will complete a minimum of 1,208 clock hours of supervised practice. Now, Ascend, they require 1,200 supervised practice hours. So we do get you in and out of this program in 8 months. At the end of the program, graduates are awarded a certificate of completion. So this is not a degree granting program. So at the end of the internship, you get a certificate of completion. Of course, you'll also get your verification statement, which is basically your ticket to take the RD exam. So that's what this next bullet point states. Now, interns with a bachelor's degree coming into our internship program, they also have the option of completing our Master's of Science degree after the internship program. Of course, I'm sure many DPD students know this. As of now, having a master's degree is not required to sit for the RD exam. But our internship program does provide an opportunity to complete our master's degree after the internship if someone wants to get a higher level degree, which I always state, it is good to get a higher level degree. Now, of course, by 2024, no graduating intern can sit for the RD exam unless they have a master's degree. So by 2024, we will combine our internship program with our master's program here at the University of Oklahoma. So until that happens, we do still have our standalone internship program where interns with a bachelor's degree can finish our internship, take the RD exam, and become a registered dietitian. But then those who choose to get a master's degree, we can offer that as well to our graduating interns. All right, now the selection process. States here, applicants who meet the admission requirements are scored based on the following. Now, I do want to state this. I didn't have this listed as at the top is the most important, and then at the bottom is the least important. I look at the applicant as a whole on what they have to offer as an applicant to our program. If, let's say, for example, I always get the question is GPA important? Now, of course, yes, GPA is important, but that's not to say that I've accepted an intern into this program who had a lower GPA, but then they had a lot of work experience in the field of nutrition and dietetics. So if maybe one aspect of your application isn't as strong, but then you compensate that with another part of your application that is stronger, again, I like to look at the applicant as a whole. But these are the things that I look at in regards to what is important for me from the applicant. Yes, the GPA is important, specifically the science GPA, or more specifically after that, the GPA from your nutrition courses, things like medical nutrition therapy. I always say that medical nutrition therapy is the foundation of all nutrition and dietetics, whether a dietitian works in clinical, food service management, or out in the community. Medical nutrition therapy, of course, is very, very important. So getting good grades in all of your nutrition classes, whether it be medical nutrition therapy, your counseling class, your food service management class, your macronutrient class, your micronutrient class. All of those nutrition courses are very, very important. The career goal statement. Yes, obviously that's an important aspect of the application. And I always say that every applicant has a story to tell. And I want to hear that story. And I really want to hear why you want to become a registered dietitian and what you want to do as a registered dietitian. Current and past work and volunteer experience. Yes, that is very, very important. Now, I'm not saying that it is required for an applicant to have current or past work experience in the field of nutrition and dietetics. But I have had individuals who have had past work experience, let's say working at the hospital as a diet tech or a diet host, or even in the hospital delivering trays to patients. And those applicants, they have already experienced working with patients, and that really helps them. That's not to say, again, that that's a requirement, but that's something that can set yourself apart from other applicants. Now, if you can't get any work experience, I know it can be hard to get work experience in the field of nutrition and dietetics. And if you can't do that, getting volunteer experience. Going to the local food bank in your community is great volunteer experience to set yourself apart from other applicants. Or another thing, and I don't have it listed here, but having the opportunity to shadow some various different dietitians. That will then get you some experience in actually getting to see what a dietitian does in the field, out there in the workforce as a registered dietitian. Getting strong recommendations. I want to mention this as well. That's an important aspect of the application. And typically what I say with recommendations is getting at least one academic reference, but my strongest applicants, they would get at least 2 academic references, meaning from one of your college professors. And then if you worked somewhere or volunteered somewhere, getting a recommendation from a registered dietitian that you worked with or volunteered with or shadowed with, those are really good recommendations. Now, I'm not saying that those are required as far as getting professors or a registered dietitian, but those are really good letters of recommendations that I see in applications. Okay. We also conduct an interview via video conference via Zoom. Once we whittle it down to a certain number of applicants, then I, along with our selection committee, if members of our selection committee are able to join in some of these interviews, then we do an interview. Now, I do want to say also that the GRE, we do not require the GRE for our program. We talked a lot about this during our faculty meetings as far as should we require it, should we not require it. The GRE, it's a good test. I'll definitely say that, but it really doesn't test the knowledge about nutrition. And so really that's what it boiled down to, was we just didn't want to have applicants complete the GRE. So we do not require the GRE. Now, our program concentration, we do have a nutrition focused outcomes, which what does that mean? So it states here, this concentration area allows interns to apply the assessment, diagnosis, intervention, monitoring, and evaluation of the nutrition care process to their work in multiple fields of dietetics. Really what this means is we are a general internship program. We do attract a lot of prospective interns who, again, they don't know what they want to do yet as a dietitian, and that's okay. Or a lot of times we have these individuals who say, I want to work in clinical dietetics, or I want to work in an outpatient diabetes clinic, or I want to work in grocery store dietetics. But then once they get in the internship, they soon realize, wow, I really enjoyed my dialysis rotation and I want to work in renal dietetics, or I really enjoyed my WIC rotation and I want to work as a WIC dietitian. So again, we do cater to those individuals who don't know what they want to do yet as a dietitian, because we provide so many different areas where an intern can see all the different areas of dietetics. Now, I do want to bring light into some of our social media pages along with our dietetic internship website. Now, if you use your smartphone to scan these QR codes, you can see our Instagram page and our Facebook page. And I have lots of pictures with interns doing various different things out on their rotation. So you can see a lot of the fun things that our interns do out on rotations. And then I also have our dietetic internship program website, where you can find a lot of information about our program, along with my email address, my contact information. And I always say to prospective interns, you are more than welcome to reach out to me with any questions, and I'd be happy to answer any questions as you are trying to research various different programs and trying to determine which program I want to apply to, or which program I eventually want to end up in. Okay. And actually, I do have, just right quick here, I'll show this. I've got our Instagram here posted. So one of the first things here is a group of our students got to go to the Laureate Eating Disorders program up in Tulsa, Oklahoma. This is actually a well-renowned eating disorders treatment facility. And we got to hear a guest talk from one of the registered dietitians. And then we got to tour the facility as well. So that was definitely a fun opportunity for our dietetic interns. You can see here, obviously during COVID, we've got our interns here dressed in PPE. So yeah, that's been a challenge, obviously, now while we're dealing with the pandemic. So, but it's also been a great learning opportunity for our interns. So here's another one here. We've got our intern in front of the Food and Nutrition Services department. Let's see here. We do a fun camp every summer, a kids cooking camp. So here's some of our interns where the kids baked pizza on that particular day. Here is a couple of interns. They are out at a fair at the University of Oklahoma. So they were doing, they had a table set up discussing food allergies. So this was a fun thing that they got to do. And then here's a picture of us at graduation day. So this is always fun when we reach graduation day. So yeah, please visit our Instagram and Facebook pages. And then of course, we've got our Dietetic Internship Program website. So if you use your smartphone to scan this QR code, it will lead you to our internship website where you can find a lot more information. I do want to mention this. We've got some open house sessions coming up here. You can see the dates and times for these open house sessions all the way through January of 2022. And send me an email. This is my contact information. Send me an email if you'd like to RSVP from one of our open house sessions. During the open house session, of course, I go through this information about our internship program. And then I do a question and answer session as well. So please don't hesitate to join one of our virtual open house sessions via Zoom. Again, something that I want to reiterate here is I love what I do as internship director. It is so much fun watching this journey that interns get to go through. And this actually, I do have one more slide here, which is a quote here. But the thing that I truly, truly enjoy is this journey that interns get to go through in this internship program, where they really get to grow. And it's such a rewarding feeling when we reach graduation day. And it states here, this is from former President Eisenhower: accomplishments will prove to be a journey, not destination. And that's what this internship will provide you, is the best possible journey. Sometimes we always think about the destination, meaning becoming an RD, okay, which, hey, that's okay. But also remember the journey that got you there. And this internship program will provide you with the tools during your journey to be the best possible registered dietitian you can be upon graduating from this program.
All right, perfect. Brian, thank you so much for that overview. Very, very thorough. Love it. I'm going to jump right into the 5 questions that I ask all programs that come on the podcast. And these questions were put together with the help of my students to make sure that I was asking the questions they really wanted to know the answers to. So my first question is, what is one thing in particular that you just really love to see when you're reading an applicant's personal statement?
Okay. So I mentioned this a little bit earlier. So every applicant has a story to tell as far as what got them to be interested in dietetics. And then I also like to see, what they want to do in their career as a registered dietitian. So definitely those are things that I like to read about in personal statements, okay, is what got you to this point that you are interested in becoming a registered dietitian, and then what you want to do as a registered dietitian. But I will say this, some of the best personal statements that I've read. Now, personal statements, all of them have been really, really good, okay? But there comes to a point where, reading through these personal statements, they all start to mesh together, where I hear like, I want to become a dietitian because of this, and this is what I want to do as a dietitian. So you've got to do something that will grab my attention when I read that personal statement. Meaning the first couple of sentences, you've got to grab my attention. And I'll say this, one of the most creative personal statements that I read, she grabbed my attention immediately on that first sentence. And then she kept tying in that first sentence into the rest of the personal statement. So she gave me permission to talk about this personal statement that she wrote. Basically what she said in her first sentence of her personal statement was, I hate biscuits and gravy. And it caught me by surprise. I was like, okay, why does she hate biscuits and gravy? Why did she say this in the first sentence of her personal statement? So she stated that first, and then she gave a little history about herself. But then she talked about how, unfortunately, her grandfather passed away from heart disease. But then one of the things that she mentioned was that, yeah, her grandfather, that was what he ate every morning for breakfast. We know biscuits gravy, it's good, but it's not the healthiest thing in the world. So she tied that into her personal statement that it was tough seeing her grandfather having to deal with heart disease. Then she talked about during her DPD program in her food science class, how she was learning about how to make a roux in her food science class with the biscuits and gravy. And it was just such a challenge for her to make this roux with the biscuits, with the gravy, part of the biscuits and gravy. But every part of her personal statement kept going back to that main topic of biscuits and gravy, and how that was just a challenge for her in various different parts of her life, but then how it then tied in to why she loved this profession, why she wanted to become a registered dietitian, and what she was going to do with the registered dietitian credential. So I thought that was one of the most creative personal statements that I've read, is make sure that you say something from the beginning that grabs my attention, because a lot of times, again, when I read these personal statements, they start to mesh, and some of the things I read are kind of the same things. Like, I want to become a dietitian because I want to help people. Well, of course, I know that we get into medicine because we want to help people, but do something that grabs my attention to set yourself apart from those other applicants when you write this personal statement.
So we're going to talk about resumes. So true or false, an applicant's resume should be one page and one page only. Either way, why?
I will say this, false, okay? Yeah, you'll hear opinions from various different individuals. I have applicants who are getting into dietetics as a second career or even a third career. I do have a handful of interns who are very non-traditional. I actually have one right now. She is very non-traditional, and this is like her third career. But this individual wanted to showcase everything that she's done in the past, which is important to her as an individual. And that's why I say, no, if it's important to you, then it's important to me as well, and I want to hear about it. So if then you've got more than one page worth of things that are important to you, then yeah, list it, okay? Now, yes, I'll say there comes to a point where you've got to then decipher what is really important for you in your resume, because then I don't want to start reading a resume that has just a bunch of different things listed on there just because you're listing things on there. If it's important to you and it's important for you to showcase that, because you want to get into this internship and you really want to show that you want to become a registered dietitian, then list it on your resume. But at the same time, I don't want someone to just list things just for the sake of listing things on a resume. So to say, for example, you have to make your resume one page. No, I don't look for that. If you've got a lot of things that you want to showcase, whether it be volunteer experience, work experience, awards and scholarships that you've received, that is important to you. And the skill set that you can bring, that you want to list on your resume, that you can bring to this internship, if that's important to you, it's important to me as well. And I want to learn about it. So no, a resume does not have to be just one page.
Perfect. Moving on to my favorite question to ask directors. So what is one thing, and maybe more than one thing, that an applicant may do, and this could be in the application itself, in the interview, and maybe some correspondence you have with them before they apply, that may raise some red flags for you, or be a total deal breaker where you would think maybe this applicant's not the best fit for this program?
Yeah. It's a great question. This is what I say is I like to look at what an applicant can bring to this program, not something that, hey, that's a deal breaker. Okay, I want to see what they can bring to this program. What skill set can you bring to be a successful intern in this internship program? But overall, what skill set can you bring to our profession to be a successful registered dietitian? So to say, is there one thing that would be a deal breaker, whether it be, oh, you aren't dressed appropriately, or you didn't style your hair appropriately, or you use, slang in the way you talk to me. I wouldn't say that any of those things are deal breakers. I like to look at the opposite end as far as what can an applicant bring to this program, not just for themselves, but their fellow internship classmates. That, hey, this is a strong individual who has raised the bar this high, and then all these other interns are like, hey, I want to be at the same level as that intern. So they're going to raise the bar themselves as far as their performance. And then these preceptors that they work with, they're going to be like, wow, this intern has a lot to bring here. I need to step up my game in mentoring this particular intern because this is a good intern. But I wouldn't say that there's one particular thing or one deal breaker that would say that, I just can't have this applicant. It's more so I want to see what an applicant can bring to our program.
All right. So my next question is, what is one aspect of the program that you really feel separates you from the competition?
Yeah, this is a great question. So I mentioned this a few times when I was going over information about our internship program. I think the thing that makes our program truly unique from other internship programs out there is that I do customize these rotations to meet your interests. There are other programs out there, not to say that they're like cookie cutter programs, but more so they're set on their rotations. Like everyone will do, a 3-week dialysis rotation, and then a 2-week rotation at a public school district, a 1-week rotation at WIC, and so forth. That everyone will be doing that. Yes, there are certain rotations that everyone will have to experience, like WIC and dialysis, but beyond those community rotations that are required, the rest of those community rotations are structured to meet the intern's interests. So if an intern is interested in eating disorders, sports nutrition, diabetes, private practice, being an entrepreneur, we have preceptors that work in all of these different areas of dietetics, and I will schedule this particular intern in those specific areas that they are interested in. So that's number one, I think, is how I customize specifically those community rotations. But then number two, something that really is unique about our program that sets our program apart from other programs is that 5-week elective rotation. Other programs do provide elective rotation opportunities, but not as long as our program. Okay? The reason why we chose to do a 5-week elective rotation was because this is on-the-job training, right? I can't tell you how many interns that I've had where they did their elective rotation at a particular facility, and then they ended up getting a job with that particular facility. And that's the way I sell it to preceptors as well, is that, hey, if you have a potential job opening coming up and you want to train and mold this individual for this particular position, host this intern for the elective rotation, because it's on the job training that they can provide as well to these interns. So that's a big benefit of spending 5 weeks in that specific area of dietetics. Another thing about the elective rotation is, again, it's the intern's choice. Whatever area of dietetics you are interested in, I will work with you to get a rotation set up in that particular area of dietetics. And again, anywhere in the United States. So again, if an intern was, let's say, from California, and he or she wanted to go back home to California to complete the elective rotation just so they can network back in California, I'm happy to explore that as an option. I'll say I can't promise you that we can make it happen, but I'm always open to exploring that as an option. So having that much flexibility and freedom in choosing an elective rotation facility, that sets our program apart. And then many interns, when they say they graduate, they say they really appreciate that elective rotation where they get to choose what they want to do for their elective rotation. And again, many interns also state to me, hey, my first job was through my elective rotation facility.
All right. Well, my last question of the 5 is a 2-parter. So we'll start with the first part. So that is, what would be 3 adjectives, descriptors, or phrases to describe your program overall?
Something that I'll say is I don't sugarcoat things here. And one thing that I want to say about our program is it's rigorous. You've got to be ready for it. But the reason why it's rigorous is because we want to prepare our interns for the workforce. Again, I stated this earlier, is our mission statements say that we want to prepare our graduates for entry-level practice. Well, again, many employers that I survey, they state, wow, your intern is at a level where they're beyond entry level. So rigorous would be one thing. And I don't want to say that to scare individuals, but more so to say that we will prepare you for the workforce. We will prepare you for your first job. We will prepare you for those unique jobs out there, whether it be in eating disorders, in pediatrics. We have a graduate. We had a class that just graduated, and her first job is actually working in a neonatal ICU. Her first job. You don't hear that a lot with graduates, because a lot of times graduates still get a general job in clinical dietetics, or maybe working in public health, or working in an outpatient clinic. Working in a neonatal ICU, that is lots of years of experience for a dietitian to get to that point. But for this graduate who reached out to me and said, hey, I got a job in a clinical facility where I'm going to work in their NICU, I was like, wow. And this is where she did her rotations at as well. So they were very impressed by her level of knowledge. And so they ended up hiring her. So rigorous is something that I would say, because we want to prepare you to be competitive when you start applying for jobs. It's not a word, but the relationships that our interns develop, not just with me and the interns, but also the interns and the intern classmates, and then the preceptors and the interns. So I guess if it's one word to use, the networking that our interns get to do within our internship program. There are so many preceptors that we use, so many dietitians, and these dietitians also know other dietitians, obviously. So our program exposes you to many different dietitians out there who will help you network. A lot of times when you get a job, it's not through a public job posting, it's through who you know. And so our internship provides interns with that opportunity to meet so many different dietitians. But of course, the interns themselves, the intern classmates themselves, they get to know each other. And it's funny, a class that I graduated 2 years ago, she reached out to me and she said, hey, wanted to let you know what I'm doing, which she was working successfully as a dietitian manager at a grocery store chain in her hometown. But then she also mentioned, man, I still connect with my intern classmates. And she was telling me that she and some of her intern classmates were going to fly out to Colorado to watch one of their intern classmates get married or take part in her wedding. So I just thought that was so cool. So the connections, the networking that our interns get to make in our internship is something that I would say really describes our program. And then the third thing that I would say is fun. Okay, this is a fun internship program. You're gonna experience a lot of different rotation sites, rotation facilities. Our preceptors, yes, they're great in mentoring, but at the same time, they're fun as well. I enjoy working with our interns, so our interns do have a lot of fun. Yes, at times it'll get rigorous where we have to get stuff done, but then other times it's a little bit more relaxed where we'll have a class day where we'll go out to, like the Laureate Eating Disorders program and take a tour of the facility. We'll go out to a cattle farm, learn about nutrition for cattle and how they get meat from a cattle or a dairy farm, things like that. So we'll have a lot of fun as well. So I like to balance the rigorous of our program with having fun in our program as well. So I think those three things really describe our program.
All right, and to wrap up that question, the second half, very similar, 3 adjectives, descriptors, or phrases to describe your ideal applicant.
Yes, this is good. And so something that I do is I always ask our preceptors is, what is something that you see? What is one thing that you see that makes an intern successful? And I get various different answers, but I typically get the same 3 things over and over again from these preceptors. And so these descriptors also obviously apply to our applicants to our program. So number 1 is flexibility. Okay? They like to see interns who are flexible in any situation. Obviously, during this pandemic, we've learned how to be flexible in any situation, but being flexible is something important. I know sometimes being in our profession, we like to have that type A personality where we like to have a schedule and stick to a schedule, but flexibility is very, very important because these dietitians, whether they work in a clinical setting, a food service management setting, or out in the community, they may think that their day will go like this, but then their day is totally different from what they planned for. So always being flexible is something that our preceptors appreciate with dietetic interns. Another thing that I would say is interns who have the ability to take initiative. Of course, I'm not out at our rotation sites and I'm not out there being able to guide our interns every day during rotations. And our preceptors, yes, they're there on site and able to mentor our interns every day, but they're not there either to hold the intern's hand. That's where an intern has to take a lot of initiative on their own, meaning they observe their surroundings and then jump in wherever it's needed. Let's say it's during a food service rotation and there's meal service going on. And then the staff, they're just overwhelmed on the tray line. Well, we don't need to tell an intern, hey, jump on the tray line and help the staff out. We want the intern to go observe and be like, hey, I noticed that they're really overwhelmed there in the tray line, and I'm going to help them on the tray line. Or another way to take initiative is, let's say an intern in their clinical rotation has been assigned to see 5 patients during that day, to do assessments on 5 patients during that day. That doesn't mean if the intern finishes their 5 patients at, like, let's say middle of the afternoon at 2 o'clock, that this intern will be like, okay, I'm going home. I've seen my 5 patients for the day. No, this intern needs to take the initiative to go to the registered dietitians and say, hey, I'm done with my patient load for the day. Are there more patients for me to see? Or do you have patients that you need to see that I can take the load off of you and I can go out there and see those patients? So taking initiative is something that's very, very important to me and to preceptors as well. And then the final thing that I would say is the ability to take constructive feedback. Obviously, in an internship, interns are learning every day. They're going to get constructive feedback every day. Some of this feedback, I won't lie to you, it's going to be rough to hear it. These preceptors, they're going to say that, hey, this is not a good day for you. Your chart notes weren't great, and so forth. And that could be hard to hear personally for an intern. When, let's say, they've seen their 5 patients for the day, They made a lot of effort to do their best to chart on these patients. And then at the end of the day, for the dietitian, that preceptor to say, hey, you didn't do well today. Your chart notes weren't great. You didn't look up these labs appropriately. You didn't address these medications appropriately, and so forth. Interns in this program, they will receive tough constructive feedback, and it's how the intern reacts to the feedback that's really important to me. I've had interns where they would not apply the constructive feedback that they received. They would ignore the feedback. They wouldn't take notes on the feedback. And that's not what is expected of interns in this program. When interns receive the feedback, they've got to apply the feedback. Now, this is something that I always say is, yes, I know it's tough to receive feedback sometimes. We get emotional, okay? Go home, get emotional, okay? If you have to cry, it's okay. Okay, I've had interns call me and cry over the phone with me, and that's okay. Get all those emotions out of the way. And then what I say is, prove to that dietitian that you know your stuff. I want you to study. And then tomorrow, what I tell this intern, you prove to that preceptor that you know your stuff. And then that's what interns do. And that's what preceptors truly appreciate, is that they took that feedback, they went home and studied that evening, and then they proved that preceptor wrong, and that, okay, you do know your stuff, and I appreciate that. So you're going to receive constructive feedback in this program. It's how you react to it that's really important to me. And taking that feedback, learning from it, and then applying it is really, really important.
All right, well, that was all the questions that I had for you today. So to wrap up this episode, I would love for you to give our viewers a little take-home message to any potential applicants.
The take-home message was similar to the last slide I showed in my presentation. Accomplishments will prove to be a journey, not a destination. This is a journey, okay? A lot of times we think about the end product being an RD, okay? But the journey will get you there, and we will provide you, again, with the best possible experience to be a successful dietitian. The journey is not going to be easy. It's going to be a roller coaster ride. There will be high points. There will be low points. There will be fun parts of the internship. There will be rough parts of the internship. But what I always tell interns, and in prospective interns, is always think about the journey, how you're going to get there to become a registered dietitian. And I think our program will provide one of the best possible experiences to get you through this journey to your destination of becoming a registered dietitian.
All right, thank you so much for being on this episode, Brian. It was so nice to have you. And for those at home who would like some more information on the program at the University of Oklahoma's Health Sciences Center and to get in touch with Brian, scan that QR code earlier in the video, but we've also included their website in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. Yay, see, that's it, yay.